Hello everyone. Today, we're diving into the world of a medication called Ivabradine, commonly known by its brand name, Corlanor. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Ivabradine, often recognized by its brand name Corlanor, is an oral tablet that works by reducing the heart rate. It specifically targets the sinoatrial node, the heart's natural pacemaker, to lower the heart rate without affecting the force of the heart's contractions. This medication is primarily prescribed to treat chronic heart failure in patients who have a stable condition but continue to experience symptoms despite taking beta blockers, or for those who cannot take beta blockers. It is also used to treat stable symptomatic heart failure with reduced ejection fraction, HFrEF. Ivabradine was approved by the FDA in 2015 and has since been an important medication in managing heart rate and improving heart function in eligible patients. Warnings: Ivabradine comes with its set of precautions. It's not intended for those with acute decompensated heart failure, which is a sudden worsening of symptoms. It's also not recommended for patients with severe liver impairment or those who have a heart rate below 60 beats per minute before starting the medication. Additionally, patients with certain types of heart rhythm disorders, such as sick sinus syndrome, sinoatrial block, or third-degree atrioventricular block, unless they have a functioning pacemaker, should avoid using Ivabradine. Before taking this medicine. Before starting Ivabradine, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the heart rate, those with pre-existing heart conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring of heart rate and blood pressure is advised for those taking Ivabradine. You should not take Ivabradine if you have severe liver disease, a pacemaker dependence, or if you're taking other medications that affect the heart rate, like verapamil or diltiazem. It's also important to inform your doctor if you have a history of low blood pressure, heart rhythm disorders, or if you have recently experienced a stroke. Before starting the medication, inform your doctor if you have ever had heart rhythm problems, liver problems, low blood pressure, or if you are on any other medications that affect the heart rate. It's also essential to let your healthcare provider know if you have a history of fainting or if you're taking any medications that might interact with Ivabradine. Side effects: all medications can have side effects, and Ivabradine is no exception. Some individuals might experience a slowing of the heart rate, bradycardia, which can lead to symptoms like dizziness or fatigue. There's also a potential for experiencing visual disturbances, such as seeing bright spots or flashes of light, especially when there are changes in light intensity. Additionally, Ivabradine may cause serious side effects including atrial fibrillation, a type of irregular heartbeat, and bradycardia that can lead to symptoms like fainting or severe dizziness. Other potential side effects include hypertension, high blood pressure, and temporary visual brightness, phosphonis. It's important to monitor for any unusual symptoms and consult your doctor if you experience any significant side effects. Interactions: Ivabradine might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications that affect the heart rate, such as beta blockers, diltiazem, verapamil, and certain antifungal and antibiotic medications, can interact with Ivabradine. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Ivabradine. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Ivabradine for most adults is 5 mg twice daily with meals. Depending on how you respond to the medication and based on your doctor's advice, this dose may be adjusted to a maximum of 7.5 mg twice daily or decreased to 2.5 mg twice daily if needed. It's important to ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid: while on Ivabradine, it's advisable to avoid grapefruit and grapefruit juice, as they can increase the levels of Ivabradine in your bloodstream and potentially lead to more severe side effects. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. As with many medications, it's recommended to avoid alcohol, as it can exacerbate certain side effects. FAQ: many wonder about the age restrictions for Ivabradine. Currently, Its safety and effectiveness in individuals younger than 18 years of age have been established for the treatment of heart failure in children 6 months and older. However, it's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Ivabradine. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.